Hi, my name is Kat Power, and I'll be giving a brief presentation on Turner syndrome. In this presentation, I'm going to talk about several topics: the basic science of Turner syndrome, symptoms, pathology, and prognosis, and the genetic medicine that can treat this condition. The basic science of Turner syndrome. Turner syndrome is a chromosomal condition that affects growth in females. In a typical cell, genes are present in 46 chromosomes. Sex chromosomes determine the gender of an individual. Males have XY chromosome pairs, and females have XX chromosome pairs. Turner syndrome specifically affects the female sex chromosome. It is a random error that occurs during the formation of sperm or egg development or fetal development. In monosomy, there is only one X chromosome, with one missing, as seen in the second illustration on the left. Mosaicism is when some cells have two X chromosomes, while others only have one X chromosome, or have an altered copy, X, resulting in an incomplete chromosomal pair. Most often, this condition features only 45 chromosomes, or 22 pairs, in one lone chromosome. As seen in the first and third images on the left, you can see the mosaicism type of Turner syndrome and what it looks like on the chromosome level with an incomplete pair on the bottom. Dr. Henry Turner discovered this syndrome in 1938, and it is fairly new. Genes on the X chromosome that are responsible for Turner syndrome have not yet been specifically identified. Thus, these points still remain in question, but it is believed that the mutation takes place during DNA replication, and the protein is underexpressed or not even formed in the chromosomes. Pathology. So who is typically affected by this genetic order? That's a good question. It only affects females. 2 X chromosomes as a pair is normal in females. Missing or having an incomplete second X chromosome, as demonstrated in the slide, results in the absence of female hormones in the cells. 1 in 2,000 girls across the globe are affected. This condition is non-discriminatory, and it can happen in any place just as much as another. The age of the child or parents, inheritance, and genetic environment do not affect this condition, although it is much more common in pregnancies that do not survive to term. And we'll talk about the survival rate and life expectancy later. Typical symptoms can vary from mild to severe in different cases. These include short stature and slow growth rate, broad chest and widely spaced nipples, low hairline on the back of the neck, non-functioning ovaries resulting in infertility, although this can be overcome with other methods, absence of menstrual onset, loss of ovarian function, underdevelopment of female organs without therapy, and we'll talk about that in just a minute too, extra folds of skin on the neck called webbing, arms that turn out slightly at elbows, lymphedema of the hands and or feet, skeletal abnormalities, heart defects, high blood pressure, kidney problems, and minor eye problems. Turner syndrome individuals are also at a higher risk for mild learning disabilities, recurring ear infections that can result in hearing loss, underactive thyroid, diabetes, osteoporosis, celiac disease, and bowel diseases. So what is the life expectancy? Well, to begin, only 1 to 3% of babies with Turner syndrome actually survive birth. But if they overcome that, they will go on to have a normal life expectancy and normal intelligence range. Family history is not a risk factor since the condition is due to a random error during cell or fetal development. And as you can see on the left, there's an image of what a Turner syndrome baby might look like, with the extra skin around the neck, widely set nipples, and swollen hands and feet. Genetic medicine. Turner syndrome is treatable and a manageable condition, so that's the good news. Genetic medicine that is used to treat this genetic disease are three different steps that we recommend. Around 4 to 6 years, we encourage growth hormone injections to encourage height growth in girls with Turner syndrome. Around 11 to 12 years, we recommend estrogen replacement therapy for breast development, and after 2 years of taking estrogen, or when the first menstruation occurs, progesterone may be administered to help maintain monthly menstruation and uterus health. This is a graphic to demonstrate the difference between treated and untreated Turner syndrome individuals, as opposed to a normal female adult, how much height growth they have over a certain period of time. And you can see that the treated girls do grow significantly more, but it is still not to the desired or normal height, but it definitely does help. And that concludes my presentation on Turner syndrome. Thank you for watching. If you have any questions, feel free to ask. Again, best of luck.